people with bipolar disorder have trauma because of it. So much of this is driven from the fact that people aren't taken seriously. I want to say, as a person living with bipolar disorder, it is real. Bipolar disorder caused you trauma. You are traumatized because of your experiences with bipolar disorder.
You're listening to Inside Bipolar, a Healthline Media podcast, where we tackle bipolar disorder using real-world examples and the latest research.
Hey, everybody, and welcome to the podcast. My name is Gabe Howard, and I live with bipolar disorder.
And I'm Dr. Nicole Washington, a board-certified psychiatrist.
And we continue to get all of your emails. Keep sending them to show@psychcentral.com, and we will keep reading them and using them to inform show topics like this one. Someone wrote in, Dr. Nicole, and asked if we could cover post-traumatic stress disorder and trauma in relationship to bipolar disorder. And they went on to explain that they feel that bipolar disorder in and of itself causes trauma. And when I read it, I thought, wow, I agree with that so much. But then my little brain started thinking, I'm not sure that bipolar disorder causes post-traumatic stress disorder, but I definitely think the things that we go through because of bipolar absolutely causes lingering trauma. And then the whole thing devolved in my mind into, is this a semantics argument? So I'm excited to turn this over to you to dissect this medically.
I think this is 100% a semantics argument. People will come to me all the time and they say, oh, I have PTSD. And I say, okay, well, tell me about the traumatic experience that led to this diagnosis for you. Because I know what, like, maybe the average person doesn't know who isn't out reading the DSM-5 for fun. The PTSD criteria is very clear that you have to have this before we can even consider a PTSD diagnosis. So that is exposure to actual or threatened death, serious injury, or sexual violence. Either you experience it directly, either you witness it happening to someone else, you learn that one of these things happened to someone who's very close to you, or you can experience repeated exposure, usually in a work setting, usually a first responder who sees a lot of traumatic things happen to other people, police officers, people who work in the child abuse area. So those are the things that we're looking at. Well, I mean, none of those things necessarily scream, this is associated with a manic episode or this is associated with a depression episode. And I think that's where we get tripped up, because people are like, hey, you can't tell me that what I experienced wasn't traumatic. I was traumatized. Like you can't tell me that I wasn't traumatized. And that's where the argument happens.
But that's I guess that's the thing, right? Nobody's saying that you're not traumatized. You're saying that it's not post-traumatic stress disorder. I think people think that if you have trauma, you have post-traumatic stress disorder. And those things aren't true. You can have trauma that's not post-traumatic stress disorder, and you can have post-traumatic stress disorder, right? They're separated.
Yes, absolutely. And we have no idea. Why is it that two people can be in the same horrible event and one of them go on to develop PTSD and one of them does not? We don't know why that happens or why that doesn't happen for the other person, but that can absolutely happen. We also know that people can come in and have horrible things happen to them and they don't meet criteria for PTSD. And you think, man, like, how is that even possible that you've gone through all those things and you don't meet criteria for PTSD? And then there's someone that goes through something that you would think maybe isn't quite as severe as what that other person went through. And here they are with severe PTSD. We have no way of knowing why that happened, but people experience trauma without going on to develop PTSD.
I gotta say, here is my patient perspective, Dr. Nicole. I think that the average person living with bipolar disorder believes that they will not be taken seriously if they don't have post-traumatic stress disorder. And I think they're right. You don't know how often I say this phrase: I was traumatized by being in a psychiatric hospital. Now, I think that if we think, hey, somebody was locked up against their will. They were committed to a psychiatric hospital. I mean, hell, how many horror movies start off this way, right? Like, but the minute that I say it, it's, oh, it was for your own good. We were just trying to help. What did you expect us to do? Did you just want us to leave you alone? So I'm telling you that I'm traumatized. I'm telling you I have a problem, and you're not helping me. So in my brain, I just have to convince you that me being admitted to a psychiatric hospital rises to the level of PTSD, and suddenly your tune will change. So step one, I want to tell all the providers who may or may not be listening, all the parents, et cetera, it doesn't need to be PTSD to be taken seriously.
Right.
Two, trauma is a real thing. Trauma is real, and it doesn't matter if the trauma happened because it was in their best interest. That's just the rock and a hard place example, right? Everything that was going to happen was going to be bad.
Yeah.
And I think that's okay. So for the rest of this podcast, we're going to be talking about trauma. We're going to kind of leave PTSD to the side, because I think what many people with bipolar disorder are experiencing is the trauma of living with bipolar disorder. Things like suicidality, depression, hypersexuality, looking people in the eyes that they've hurt because of mania or depression or anxiety. Even things like being committed to a psychiatric hospital, losing jobs, quitting, hurting yourself, feeling this way. All of these things cause real and legitimate trauma that we're going to be
Yeah.
discussing for the rest of the episode.
And I do think it's important that the loved ones, the treatment team folks who are listening realize that our words matter too. We can we can avoid poo-pooing people's experiences by telling them, well, I mean, that doesn't really rise to the definition of a PTSD trauma. You don't have PTSD. That is quite invalidating, because I think what people really want to hear is, wow, that sounds like that was really difficult for you. And while you might not necessarily meet the formal criteria for PTSD for an experience like that, we still need to work through that, because it sounds like that was very tough and that was a lot for you to have to deal with. Because I can't think of another word to describe, someone who's involuntarily hospitalized. The police are called, they're seemingly arrested from the outside view if neighbors are watching, and you're put in the back of a police car in handcuffs at the peak of mania, and then you're dragged off to this mental health hospital where they keep you locked up and locked away, and you may be medicated against your will. I can't think of many more words to describe that experience aside from trauma. Like that would be a very traumatizing experience for me. And yes, while someone might come back and tell me that doesn't that doesn't count, that can't be that, you just can't tell me it didn't hurt me in that way. So I love that we're gonna not worry about the PTSD so much and not focus on that as much as we're going to focus on the trauma itself.
Dr. Nicole, as a doctor, do you believe that people with bipolar disorder can be traumatized by bipolar disorder?
Absolutely. I would be traumatized if I had some of the experiences that some of my patients have.
I definitely think that one of the things that adds to these feelings of being traumatized or being a victim is the fact that we can't get anybody to say, yeah, what happened to you sucked. Using the very specific example of inpatient commitment, again, that objectively sucks. Hard stop. It
Yeah.
doesn't mean that it wasn't in your best interest. It doesn't mean that's not what needed to happen. It doesn't mean any of those things. It just means that what happened to you sucked. Dr. Nicole, if I may, I would like to use an analogy. I'd like to tell a
Not Gabe
story.
with an analogy.
I
Okay.
know, I know.
Okay.
I was thinking, several years ago, my father needed to have open heart surgery, and the night before open heart surgery, when he was doing the fasting thing, he was really worried about it, and he said, I'm really worried about this. They're going to saw open my chest, and I said, God, what a baby. We're all here to support you. We're all here to help you. The doctor isn't trying to hurt you, and all you can think about is that something bad is going to happen to you. Now, anybody listening to this should think, my God, you're the worst son ever. Why would you say that to a man who's scared to have open heart surgery? Yeah, exactly. I would never say that. What I said is, yeah, I know. We're going to do our best. We're here to support you. We're here for you. What can we do right now to take your mind off of it? Let's watch movies, whatever. Let's get you through this, and then we'll focus on it on the other side, and let's believe in the doctors and believe this is best. But yeah, I completely understand why you're scared. I'm scared for you. But yet, for some reason, with people with mental illness who say, I'm terrified of the trauma. I'm terrified of this happening again. I'm terrified of going back to that dark place. We immediately start the, oh, you'll be fine. Oh, well, what were we supposed to do? Oh, your doctors are trying. Well, if you just take your medicine, you'll be fine. We don't actually validate their feelings. And people with bipolar disorder are picking up on this in huge ways because they're already scared and now they feel invalidated and unsupported. So that absolutely drives this trauma response, in my opinion.
Gabe, it actually sounds like a lot of the problem is not the fact that you experience this thing, but the way that everybody else responds to this big bad thing for you.
I think there is an element of the way society, not just the people closest to us, not just our friends, not just our doctor. I think there's a huge problem with the way society perceives a mental health diagnosis and what we as a patient experience going through mental health treatment. Um, this is a little bit off topic, but I think it's worth bringing up. One of the things that many people with bipolar disorder realize is that if they do well, all the credit, the hero, if you were, is the doctor, the pharmaceutical companies, and the researchers. But if you're doing poorly, all of the blame goes to the patient. They're not med compliant. They're not working hard enough. They're not trying hard enough. They're not using their coping skills. And I think that this weighs heavily on patients. Now, as far as patients listening, you're like, that's great. Just get all of society to change, and I will no longer be traumatized anymore by bipolar disorder. Thank you so much, Gabe and Dr. Nicole, for helping me move on from my trauma by explaining that none of it's my fault and that the whole world just needs to change. This is great. Please keep listening. We do have more to say.
Most of the things that happen to people that are traumatizing, I think, are outside of their control. Most of the things I would say that for. I like that you blame society as a whole, not just the support system, not just the people that they have close contact with. I think also that what has made this even more complicated is that pop culture has now latched on to trauma. Everything's a trauma. Everything's traumatizing. Everything is. And it can be the most benign stuff that people will describe as a trauma, that it takes the fire away from it. It takes the seriousness away from it. Like, traumas are serious events. Traumas are big deals. But when people just throw around the word trauma like it's no big deal, it waters it down. It takes away from people's experience. And I have to believe that also adds to some of this. So you're right. It's a larger societal issue in addition to the people that are in your direct circle.
When I think about spinning this around to what people with bipolar disorder can do, one of the things that I think about very specifically with their people, not necessarily the greater society, but with their support teams, with their friends, family members, coworkers, even their Dr. Nicole's, I think one of the things they can say is, I understand that, and I'm not blaming anybody. I am just telling you that this is weighing very heavily on me and it is preventing me from moving forward. I am asking for your support and help because this is on my mind. And I know that's a lot, right? It's really hard, right? So you can say it differently. You can be like, yeah, it's not about them. This is about me, right?
Yeah.
Like I'm struggling. I'm asking for help moving forward. Use whatever words are good for you. But I do think that one of the things that we can do is grab the bull by the horns and challenge this notion, right? And I think a lot of times we fall apart. We're like, oh, okay. And then we go on and we never bring it up again. Or we start to feel bad. You're like, well, that's a good point. I didn't mean to insult my mom, dad, brother, sister, wife, husband, friend, etc. So you're right. I should back off of this. I think we need to make a hard boundary. This isn't about them. I'm not commenting on them. I'm only talking about my feelings and all of this. And I'm really struggling.
Yeah. And I think it does help when you're a person living with this disorder to also ask yourself the question, what role do I play in this?
And we're back discussing bipolar disorder and trauma.
started off by saying, I think that most of the traumatic things that happen to people are things that end up being outside of their control. But if some of those traumatic things happen as a result of not necessarily putting in the work to manage your illness or to do your part, then you do play a part in this trauma that keeps happening over and over again for you, for some people multiple times before they finally are like, okay, it stops here. I have to do something different. But there is a responsibility that the person with the illness has. So I like the idea of saying, like, I can only focus on me. I can only focus on the things I can change. I can't do all that other stuff. We have to be able to ask ourselves, okay, what can I do to also help?
I completely agree. The only person we really have control over is ourselves. And even that can be sketchy at times because of bipolar disorder, right? I mean, it's a mental illness. It is impacting our ability to think. But if you are listening to this podcast, if you're looking for resources, one of the things that you can do is go see a therapist and say, I want to discuss the trauma that I went through because of bipolar disorder, including, and be specific, the inpatient hospitalization, realizing that I cheated on my spouse because of hypersexuality, realizing that I told my mom I hated her because I was manic, understanding the things that I said or did when I was blacked out because of, again, the symptoms of bipolar disorder, learning about the mistakes that I made and really trying to make amends has really made me realize that I'm not the person I thought I was. And that can be traumatizing. Working these things out with a trained professional is good. But the part that I want to point you as the person living with bipolar disorder to is you can make that appointment and put that on the menu. I really think that the mental health community as a whole does a huge disservice to people with bipolar disorder by often not bringing these things up to them, not
Yeah,
saying you have gone through a great trauma and you should seek help for it. So, Dr. Nicole, you're a
yeah.
medical professional. Do you think it's a good idea for people with bipolar disorder to seek help for this?
Absolutely, Gabe. I actually think that we sometimes don't even recommend people with bipolar disorder or illnesses like schizophrenia go to therapy because it's almost as if we think, well, you just need medicine. Like, medicine is what you really need. Like, therapy isn't going to help you when you're manic. Therapy isn't going to stop you from having an episode. Therapy isn't going to do all those things. And I think that's ridiculous, actually. Uh, I do think that illnesses like bipolar disorder, schizophrenia, the ones that we don't typically think of as being amenable to therapy, absolutely people can benefit from being able to work through all the stuff. There is a lot of stuff. There's the I don't want to take meds. I don't want to be on medicine because I hate how it makes me feel, but I also don't like how I am when I'm unmedicated. And so I feel like there's not a good space. Like, I'm always miserable. I have to choose the lesser of the evils, and that feels really icky. Like, that is a place where I think someone with bipolar disorder can absolutely work through some stuff in therapy and try to find some agency, some independence, some autonomy, because it feels like, especially in that particular scenario, that you're a slave to whichever choice you make. You're either decision you make, you're going to hate it.
Exactly,
And
exactly.
that sucks.
And I think that can be traumatizing as well. You have to make a
Yes.
decision where either
Yes.
outcome is bad and live with the consequences. I am a huge proponent of therapy. Therapy has helped me a great deal. It both validated my feelings and helped me move past them. So I want to make sure that people hear therapy good. So in addition to therapy, because sometimes people hear that this is an either or and it's not, you can do both. I'm a huge believer in peer support. I love peer support. And there are so many national groups that are offering peer support groups, both online and in person. Groups like the Depression Bipolar Support Alliance, DBSA, groups like NAMI, groups like Mental Health America, and even our own Healthline has the Bezi Depression Community, which isn't specifically for people with bipolar disorder, but I'm always going to give a shout out to Healthline. Utilizing any of these resources to just find like minded people even if all they can do is say, hey, we have walked this road as well, you are not alone. I feel that that has immense value. But oftentimes, they also have suggestions of things that they have done or experienced that you can put into practice, or at least try to put into practice in your own life. So I don't want to gloss over peer support here.
No, no, definitely an and, not an or. There is something very validating in having someone say, "Yeah, I've been there, and that was very traumatizing to me, and this was my experience as well." There is nothing that can replace peer support, in my opinion, in all of our treatment team. I do think with the therapy piece, it is helpful for you to know when you walk in to start, what do you hope to look like at the end? Where are you going? What do you want to get out of therapy? Every day somebody tells me, well, I don't do therapy because I went and I talked to somebody and I just kind of vomited all over them for an hour. And then we walked away and said, see you next week. And we just repeated that for months and months on end. And I don't feel like I ever got anything out of it. And I asked them, well, what was your goal in going to therapy? And they have no idea. So I
They
agree.
have an idea. They want the trauma to go away.
No, they don't have an
You're telling me
idea.
that that's not a reasonable thing to want out of therapy?
No,
They want the trauma to go away, Dr. Nicole. What do you mean they
Gabe,
don't know? They want to
walking
feel
in and
better.
no, well, that's not good enough. You can't just walk in and that's like getting in the car and saying, I want to go somewhere. That's not going to help you. You can get in the car, since you like analogies so much, you can get in the car and you can start going somewhere. And if I call you and I say, hey, Gabe, where are you going? And you're like, I don't know, I'm going somewhere. Well, that's true. Well, how are you going to know when you get there? When are you going to stop driving? How do you know when you need to take breaks? How do you know? You don't, because you had no plan. You have to walk into therapy knowing I have bipolar disorder and I've experienced some things that are really traumatic to me. I don't know if I have PTSD or not, but I know I can't stop thinking about this really crappy stuff that happened to me as a result of my bipolar disorder. And I need to be able to get to a point in my life where it's not consuming me. That is a better first conversation to have in therapy, other than, well, I'm just here to get over my stuff. I got stuff.
I really like those specific examples that you gave, Dr. Nicole, and I want to add two more onto that. One, I think that people really don't want to think about this every day. They want time to go by without them thinking about it. Yes, sometimes trauma catches you off guard, but many people who are complaining about this is impacting them every day, frequently. The next thing is I think they don't want the trauma to define them. They want to define themselves in some other way. And I think one of the nice things to look for in peer support, therapy, and even self reflection is, what is defining me? And for many people who are talking about this trauma, they are being defined by the trauma. Looking for something else to define you, I think, is a really, really tangible and worthy goal.
And if we're gonna stick with my analogy, because now
I
I'm on
love
a
it.
roll.
It's a good
Now I'm on a
analogy.
roll. I'm on a roll,
See,
Gabe.
analogies are fun. They're fun. You
Now
didn't
I'm on a
know.
roll. When you are planning your trip and you have your map and you know your pit stops and you know what your little markers are going to be on the way to the big trip. If you drive cross country, you know, I'm going to stop here, I'm going to stop there. Having those smaller goals for yourself and knowing what that looks like can be very helpful. Therapy can be very defeating. Therapy can feel like this insurmountable thing that you will never ever top. If I'm getting in my car in Oklahoma and I say I'm driving to California, I'm going to be very defeated looking at how many miles there are between Oklahoma and California. But if I say, oh, I'm going to stop along the way here and I'm going to stop there, and I know that those are my little check marks, my little checkpoints, you need to have those checkpoints with your therapist. You need to be able to check in and say, you know what? I noticed that I'm not doing this one small thing nearly as much as I used to. You need to be able to identify those little things along the way.
And I want to broaden that out. I completely agree that you need to have those with your therapist, but you need to have these in your life.
Yeah.
Whether you're working with
Yes.
a peer supporter, whether you're going to a
Yes.
support group, whether you're listening to this podcast and trying to decide if you're getting better, whether you're using self reflection, reading books, whatever.
Yeah.
Small, measurable goals are always going to make you feel better than you're either a success or a failure. And I know that black and white thinking is a huge part of bipolar disorder. We're
Yes.
either well or we're not well. We're either
Yes.
traumatized or we're not traumatized. And we need to expand our thinking in this arena to do better.
Yes. And working on, how do I celebrate the little things and not just brush them off as little things? If there's a Saturday where you all of a sudden got up and put clothes on and didn't stay in your pajamas all day and you actually brushed your teeth, you should celebrate that. That should be celebrated, not, Like, well, I'm not going to celebrate brushing my teeth. Like, that's what I should have been doing this whole time anyway. Not that thought. The thought should be like, wow, look at me. This is a plus. Like, I did good. I put clothes on. They're clean. I took a shower. I brushed my teeth. Like, wow, I'm pretty proud. I'm adulting today. This feels good. I think we have to learn in all aspects of life how to celebrate the little steps along the way, because that's what stops you from giving up. Because trauma is hard and it's big and it's tough and it's scary, but that's how you make it to the end. That's how you make it to California. You make it to the end of this journey by realizing that I had all these little steps along the way, and now I've made it to this place where I'm trying to get to. But it is hard. And so we have to learn how to celebrate the small victories along the way.
Hopefully by this point in the podcast, you're starting to look at trauma differently and realizing that you can influence it and you can move forward. It's going to be hard. It's going to be difficult, but it is possible. And I really hope, Dr. Nicole, that we've done a really, really good job of validating that your trauma is real. I have experienced a lot of it myself with what I've gone through. I could tell endless stories. So I have been where you are and I got through the other side. Dr. Nicole, we've covered a lot of things about trauma, and I don't even really think that we covered the tip of the iceberg. I hope that we have given people a different way to look at it, to feel about it, and some definite ideas on how to move forward, and covered some of the types that come up a lot in your practice and in support groups and in our email box. It's difficult to live with bipolar disorder. And it's not surprising that that difficulty is traumatizing. I think that bipolar disorder is traumatizing, hard stop. And I really wish that the world understood that. But we're doing our best to change society. But it's been slow going.
One episode at a time. One episode at a time.
One episode at a time. All right, everybody. Thank you so much for being here today. We need a whole bunch of favors from you. First, wherever you downloaded this podcast, please follow or subscribe. It is absolutely free and you don't want to miss a thing. Next, tell everybody you know. Share your favorite episodes on social media. Bring us up in a support group. Text, email your friends. Leave us a comment on Spotify or iTunes. Just do everything you can to raise the knowledge that people have about the Inside Bipolar podcast. And with that, my name is Gabe Howard. I wrote the book Mental Illness is an Asshole and Other Observations, which you can get on Amazon, but you don't want to. You want to go to my website and get a signed copy with some free swag. And that website is gabehoward.com.
And I'm Dr. Nicole Washington. You can find me on all social media platforms at Dr. Nicole Psych or on my website, drnicolepsych.com.
And we will see everybody next time on Inside Bipolar.
You've been listening to Inside Bipolar from Healthline Media and PsychCentral.com. Have feedback for the show? Email us at show@PsychCentral.com. Previous episodes can be found at PsychCentral.com/IBP or on your favorite podcast player. Thank you for listening.